Hi, my name is Dr. Elisabeth Miron, and I'm a chiropractor in North York. Today I'm going to talk to you about scoliosis. What is scoliosis? Scoliosis is an abnormal curvature of the spine. If you were to look at the spine from the back side, the normal ideal situation is that all of the vertebrae are lined up vertically against one another in a straight line. In scoliosis, however, what happens is that there's an abnormal sideways deviation of the spine, so that it either takes on a C shape or an S shape. Those are two variations that can occur. Now, there are two broad categories of scoliosis. One is a postural scoliosis, and the other is structural scoliosis. So, my goal here today is to differentiate those two different types of scoliosis, to describe the chiropractic management of scoliosis, and then lastly, to differentiate that from the medical approach to scoliosis. This is so that you can better understand some of the different options that are available. So firstly, postural scoliosis versus structural scoliosis. A postural scoliosis is a flexible scoliosis. It's basically an adaptation to an imbalance in the base of support. So what happens is, for example, there's a leg length inequality. That can happen for a number of different reasons. It can be from a knee problem, or it can be from a problem with the alignment of the feet. So for example, one of the arches on one side has dropped down, then that creates what is considered a functional leg length inequality. It causes the pelvis then to dip down on one side, and then everything else, it just translates up into the rest of the body. So if you look here, the pelvis will dip down, and then what would happen is that the rest of the body will adapt. There's actually this righting reflex. So basically what happens is your eyes want to remain horizontal. So if the pelvis dips down and the eyes remain horizontal, then you can see that there would be a scoliosis in the spine. So like I said, that is a flexible scoliosis. It's an adaptive response to a problem with the base of support. This type of scoliosis is very straightforward to correct. So first, one would have to undergo an assessment to determine what exactly is the cause of it. So if it's a problem with the feet, then that's easily solved by a custom foot orthotic to realign the feet into a more neutral position, or a heel lift to address a structural short leg, which would then rebalance the pelvis, and then the rest of the spine would be straighter as a result. For this type of scoliosis patient, I may also recommend a course of chiropractic care. The reason is because after years of postural imbalance, because there's an adaptation, certain muscles may become tighter and certain muscles may become weaker, and there may be even some irritation into the joints or the muscles. So chiropractic care is very effective at reintroducing some more of that balance into the body and helping to also alleviate some of the discomfort that results. So that's postural scoliosis. The other type of scoliosis is structural. So structural scoliosis tends to be a rigid curve. So it's very solid. There's actually a few different types of structural scoliosis. One of the most common is what they call adolescent idiopathic scoliosis, and basically what happens is it's for unknown reasons, but the spine just grows that way, and it's rigid. Chiropractic care for this type of scoliosis is a bit more involved. It requires more work. Definitely the chiropractic manual care, hands-on care is a good approach, not only for addressing the pain problem, but also for helping to improve the flexibility of the spine and also to improving the balance in the spine. In addition to this, there's certain exercises that are extremely beneficial. For example, proprioceptive exercises. Proprioceptive exercises are exercises that help to improve your body's position awareness and sense. For example, exercises that are done on an exercise ball, exercises that are done on a balance board or a wobble board, things like Tai Chi or yoga, those are all extremely beneficial for improving your body position, sense, and awareness, and as a result also improving scoliosis. In addition to this, specific corrective exercises may also be prescribed. So exercises that are used to specifically strengthen those muscles that have become weaker and to specifically stretch and loosen some of those muscles that have become more tight. Is scoliosis necessarily a bad thing? Well, there are some risks. It's not necessarily bad in every situation. What the literature shows is that as the degree of curvature is increased, there tends to be more back pain compared to somebody with a lesser curve. You have to remember that scoliosis is an abnormal distribution of forces throughout the body. So there's this uneven wear and tear, there's this uneven use of the muscles, there's this uneven force and pressure on the joints. So this can all set up a situation where you may feel some pain and discomfort as a result. Another risk of scoliosis is that, especially in cases where the spine is still growing, is that it may even progressively get worse, as in the curve may get bigger and bigger as time goes on. We don't want that to happen, obviously, because there's also a risk that with very severe curves that it may even compress on the internal organs and affect the functioning of those as well. Scoliosis is not normal. It doesn't guarantee that you will have a problem later on, but it's definitely worthwhile to have an assessment, or if you don't know you have scoliosis, to have a spinal health examination to determine if you do or not. Now, what is the medical management of scoliosis? There's basically 4 things that they may do. One is monitoring over time. If an individual is still growing, it's important to monitor the curve because, as I said, it may get progressively worse. So usually what is done is someone will have a full spine x-ray every 3 to 6 months or so to determine if it's getting worse or not. Another management strategy is medication. The medication is purely a symptomatic relief of the scoliosis. There is no such thing as a drug that will take away a scoliosis. It's just symptomatic. It does nothing to resolve the underlying cause. If a scoliosis progresses beyond a certain amount, it is typically also recommended. The third option here is bracing. There's spinal braces that are intended to help prevent further progression. The unfortunate thing about them is that they're kind of uncomfortable and awkward, although there have been some improvements made in the types of available braces over time to help to improve patient compliance. So that's another option. The last option from the medical model is to have a spinal surgery. The spinal surgery is basically an invasive procedure where they insert a metal rod into your spine. So it has many inherent risks. If you consider all the various different options that are available, in my opinion, chiropractic care is a very reasonable approach. It is like more of a mechanistic approach. It helps to relieve the pain naturally. It helps to make you more posturally aware. It helps. What the literature is showing is that it may help to prevent progression of the curve, and in some cases may even improve the curve. So certainly, in light of all the different options, it's definitely a reasonable approach, very safe and effective. So If you know you have a scoliosis, having an assessment from a chiropractor is a good idea, so that you become more aware of this approach, and if this type of option makes sense in your particular case.